Hi, my name is Ben Atkinson and welcome to the Functional Health Podcast. I interview some of the leading voices in nutrition and lifestyle medicine, and I will share with you their stories, their expertise and their advice, shedding light on the industry from each of their perspectives to help improve your health from today. This week, I'm delighted to share with you my conversation with Dr. Elisabeth Philipps. Elisabeth is a neuropharmacologist and functional medicine practitioner, and today we're diving into the world of phytocannabinoids, including CBD, and their role in health and disease. So, without further ado, Elisabeth, welcome to the show.
Hi there, Ben. Thanks for having me on.
Oh, you're so welcome, and I'm so happy that we had the chance to connect through our mutual friend, Rob.
Absolutely. I know it's quite fortuitous, isn't it, to have these connections throughout the integrative medicine world.
It's very much everyone knows everyone, it seems, right now.
Yes, absolutely.
How are you finding it in these unusual times that we're currently in?
Yeah, I mean, it's certainly been quite a year, hasn't it? I mean, you know, on a sort of a work front, in many ways, things haven't changed because I work from home a lot anyway, with my consultancy and clinical work. But obviously there's been massive changes for people's health and also the education side as well. So most things have gone online. It's been absolutely fine, really.
Fantastic. It's good to hear that you're flourishing. So jumping ahead straight in, cannabidiol, also abbreviated to CBD, is one of the many chemicals found in cannabis. It'd be great to know from you what CBD is, and I think more importantly for the general population and the public, what it isn't.
That's a really good question because there are a lot of myths around and I think it is very confusing, isn't it, Ben? So CBD, as you say, cannabidiol, is a type of phytocannabinoid or plant cannabinoid found in the hemp plant. And hemp is a member of the cannabis family. In particular, it's the strain Cannabis sativa or sativa L. So CBD is taking the food supplement world by storm and health areas by storm because it's been found to have a lot of benefits and potential actions within the body. But what it isn't, and this is very important, is that it isn't the other phytocannabinoid, which is THC or tetrahydrocannabinol. And THC, you may be familiar with, is the cannabinoid, the phytocannabinoid that has psychoactive components. So really what that means is it's the cannabinoid that gets you high. It's a very important distinction. So CBD is legal in the UK. CBD is also legal in the sports world as well. It's not on the banned substance list for the World Anti-Doping Agency or WADA. Whereas THC is. So THC is present in medicinal cannabis, for example, but that's why medicinal cannabis requires a license and is a Schedule II drug now. So as I say, CBD is legal. It's a phytocannabinoid that interacts at a number of different systems and levels in our body and can have a whole host of benefits and positive outcomes. Clinically speaking, the main ones are on mood, so like anxiety and depression, also pain, very good at reducing inflammation and pain, and promoting sleep, better quality sleep as well. So we've really got this plant-based nutrient found in hemp, which is extracted into oils or maybe into topical rubs or joint gels, for example, that can actually, really provide clinical benefit.
Fantastic. Well, all those benefits sound absolutely astonishing and too good to be true in some instances, but a lot can be said for some other chemicals and phytochemicals as well, such as curcumin, which is often touted as, the king of the kind of herbal supplements.
Yeah, absolutely. And again, I am the first to say that there is still clinical evidence is playing catch up. So, I'm not touting this in any way as a sort of a wonder cure. We are very much integrative medicine practitioners. I am one as well, functional medicine practitioner. And so this is very much part of any program. And it's not a cure-all on its own in any form. But what I would say is that we quite often we don't neglect, we just don't understand how it works in the body and the endocannabinoid system, which is the main system where it kind of interacts. So it's almost like another tool is how I see CBD, another tool in our toolkit as practitioners, as clinicians, as to use as part of a sort of dietary and lifestyle and food supplement program.
because you seem to wear many different hats in your day-to-day life. And I wondered, where did your interest in CBD begin? Because it's quite unusual, I think, these days.
Yes, yeah, absolutely. So my original training is in biomedical science, and then I specialised in neuroscience. So I did my PhD in quite specific areas in the brain, looking at certain types of glutamate receptor assembly, and then ultimately how this is broken down in processes such as neurodegeneration found in Alzheimer's disease in particular. So I've always had a real interest in what goes on in the brain and what goes on in the body. And then through my own health experiences, I went on and studied nutrition and nutritional medicine, and sort of really putting all that together. What I noticed about 3 years ago when I was, sort of in clinic, was this sort of boom in CBD, and what is it? And really, why is it going to be of any benefit to, myself and to my clients? But actually, the more I read, the more I realized we didn't understand anything about the system that it mainly worked in, the endocannabinoid system. So being a research scientist, I just, researched because I just love, this sort of fascinating, the idea that we've got this system in our body that's relatively newly discovered in the early 1990s. And it just makes so much sense because it's almost like an interface between the central nervous system and the immune system is one of its many roles. So I just gained a really big interest, and then it makes sense with my neuropharmacology background to be, involved in the medicinal cannabis and the CBD worlds. So that's sort of really the last 3 to 5 years.
Fantastic. That's incredibly interesting. And I actually saw a relatively recent post on Instagram by you looking at the endocannabinoid system and its role in immunomodulation, I believe.
Yeah, absolutely. So I do a whole host of, education webinars and conferences and talks and the like, because that's one of my sort of big passions, is to really sort of promote a better understanding of CBD and the endocannabinoid system. So, what I was looking at on that particular webinar was the sort of modulation of the immune system within the brain and the central nervous system, because whilst the inflammatory mediators, pro-inflammatory mediators, are quite similar or the same, it's actually quite interesting that the brain and the nervous system has its own immune system. So the webinar was sort of based around a little bit more understanding in that area. And people can find the webinars on NutriHub if you're interested in seeing any recordings. So nutrihub.org.
Brilliant. I'll link to that in the show notes for the listeners also. Is that endocannabinoid system present in all of us? And when I say that, what I mean is there a different endocannabinoid receptor density in different people and also between different sexes?
Well, that's a really great question, actually. So first of all, yes, we all have an endocannabinoid system, and it's not something that's just sort of popped up. And, in the last sort of few decades, we've just developed one. Actually, sea urchins and starfish all have endocannabinoid systems. So this is an evolutionary system, one that has evolved, really to keep us going, right from the beginning. But it was only really, as I say, discovered in the early 1990s when researchers were looking at the targets of THC. Actually, why was THC having the action that it did in the body and in the brain? So it's a very interesting that it's so newly discovered, but I think that's because it's very diffuse and you can't visualize it as beautifully as you can the cardiovascular system or the nervous system when you see all those beautiful images that you can find in medical texts. It's really a series of receptors and enzymes and our body's own chemical mediators, the endocannabinoids. So it's the fact that it's diffuse, I think it's kind of been sort of misunderstood or overlooked quite often. But in terms of density, we all have certainly the CB1 and CB2 receptors, which are the ones that are known about at the moment. There are other targets as well that CBD works at in the body. So there are other potential putative CB receptors, cannabinoid receptors. And, certainly there's going to be changes. And, there's one very interesting study actually showing that lifestyle can really impact the levels of CB1 receptors in particular. And we find CB1 receptors particularly concentrated in the brain and the central nervous system, though also throughout other organs in the body. It's the CB2 receptors that tend to be distributed throughout the sort of gut, the spleen, the kidneys, the lungs, the heart, many other different areas. And in stress, chronic stress, the study shows, a 2018 study, that cortisol, actually high cortisol levels, chronically raised cortisol levels, down regulates CB1 receptors in the brain. And so, I think what that tells us is that, our endocannabinoid system is very sensitive to our lifestyles, to what's going on in our bodies. So we have the ability to regulate the density, I guess, if you want as well, to put it like that. So yes, there will be differences, between individuals and between groups, but we also have the ability to manage that.
Okay, that's fascinating. And I guess, just from listening to you, that would make sense why people use CBD in instances where they are stressed chronically or even just acutely.
Yeah, absolutely. So, as I say, the sort of CBD, because it seems too good to be true, because it kind of hits all of these points and very, sort of prevalent health conditions as well. But there's no doubt that the CBD, has the potential to really work in instances of acute and chronic stress as well. And I see that through patients of mine when, we're looking either in a sort of a short-term acute setting, maybe with, sort of certainly in sports area that I work in, sports injuries, stress around, match anxiety, for example, and performance anxiety, through to people with, longer term, stressful conditions, as well, maybe arthritis, chronic fatigue syndrome, that, a whole host of areas, just to name. So yes, absolutely. I think as part of a toolkit, CBD has the potential to balance our endocannabinoid system, which is, really important for homeostasis. It helps our body sense and perceive changes and, helps the body to right itself, because after all, Ben, we know the body wants to be well. That's its default setting, isn't it? I say that to all of my patients, your body knows how to be well. We just need to nudge it or maybe push it in quite a way to get back to that point. So being the endocannabinoid system being involved in that homeostatic balance and the perception of the body is, therefore using CBD has the potential to really help in areas of stress and other areas.
So in terms of what CBD does from a physiological level, does it regulate things like hormonal activity? You've touched upon cortisol and the CB1 receptor, but does taking CBD modulate how cortisol is produced or maybe how it's broken down?
So, as I said, the endocannabinoid system is diffuse. You can find the CB1, CB2 receptors sort of spread throughout different organs in the body, but different cells in the body as well. So it's highly prevalent in immune cells. Mast cells, for example, express CB2 receptors, various phagocytes, astrocytes within the central nervous system. So, really, the potential to regulate hormone. In terms of sort of breaking down cortisol, I don't think it's kind of necessarily along that pathway. It's more about, how the cells are responding to cortisol and the balance in that area is probably a more sort of appropriate understanding of how sort of the endocannabinoid system is working.
When you mentioned astrocytes there, because astrocytes are prevalent in the brain and spinal cord, or the central nervous system, I should say. How does it modulate them? Does it downregulate? Or maybe you can answer that question rather than me guessing.
No, guess away. So astrocytes, yes, as you say, I mean, they used to be known as brain glue, and certainly back in the day when I was doing my PhD, astrocytes were kind of seen as scaffolding within the central nervous system and within the brain in particular. But they're now known to be so much more, and they're not just scaffolding, but they're kind of environmental sensors. So what's CBD is doing. So probably if I just backtrack a moment as well, CBD doesn't directly interact with the CB1 and CB2 receptors. And so this is another reason why I like CBD so much. It's a very elegant plant nutrient. What it's doing is it's balancing the body's own endocannabinoids, because it blocks the enzyme, the FAR enzyme, fatty acid amide hydrolase enzyme, and that is the enzyme that breaks down anandamide, which is one of our body's own endocannabinoids. And anandamide is Sanskrit for bliss, which I think is a lovely name for a molecule in the body. We have known for thousands of years, obviously, what this is doing. We've just not understood how it's done it.
Mm-hmm.
So what CBD does is it prevents the breakdown of anandamide. So anandamide is then at better levels, higher levels, so is able to then trigger the responses in the endocannabinoid system. So what CBD is doing sort of around astrocytes, in particular, and the sort of the immune response within the brain is that it's sort of providing that balance so that there is a better sort of sensing and ultimately if there is a sort of a level where the cells aren't primed, because when we have our immune system in the brain, when it's primed, this is when it can tip over into sort of chronic inflammation. So the endocannabinoid system is kind of preventing that sort of priming and that chronic trigger. So it's again just sort of helping sort of the sensing aspect, if you like, the environmental sensing aspect of the astrocytes.
Okay, amazing. This is definitely something I need to look up, actually, because I remember I used to work with people with MS, and there was a lot of astrocyte microglia crosstalk, and that was something which hugely fascinated me, but I wasn't aware that the endocannabinoid system was involved in this. So this is something which I think I should dive into at a later date for sure.
Absolutely. I mean, with MS, as you say, that sort of frustrated resolution, they call it, of microglia, where you get that sort of that priming and that switching on and that chronic activation is, a real sort of underlying pathway within MS and other, neurodegenerative processes. But astrocytes are, as you say, involved in that crosstalk, and really sort of the endocannabinoid system is kind of, a key player across that area.
This is absolutely fascinating. Oh.
Okay. I know, this is why I love the brain, and this is why I studied the brain way back at university, and why I now just am passionate about the research. I do clinical research and working with patients and talking to you and fellow practitioners. It's just, I love it. I love the fact that we can still discover something new about our human bodies in the last couple of decades. It's great.
Yeah, no, you're absolutely right. And this is one of the reasons why I love this kind of nutritional, functional medicine, lifestyle medicine space, is that you're just constantly learning. Like, I learn something new every single day, which is just brilliant. It just keeps me motivated. Okay, something else which I wanted to speak to you about was the kind of controversy that CBD has still to this very day. And you mentioned this. There was kind of like a rise in CBD products on the market. Holland & Barrett sells it now, and 5 years ago it was really nowhere. You couldn't really buy it on street shelves, and now it's in vaporizers and things of that nature. Why do you think that's changed?
I think the popularity is, first of all, because if you get the right product with the right levels of CBD, and we will come on and talk about that, I'm sure. Yes, so I'm talking about the right product, but a product that works, then you can see really amazing benefits. And, I think, again, the benefits are arising, even if you're somebody, and I put myself in this category as well, that, has really done an awful lot to change your health, through nutrition, through lifestyle. You're getting to the stage now where you really understand it very deeply. So maybe you're tweaking some, sort of finer points rather than just, removing gluten or, whatever the sort of the aspect is. And, again, the endocannabinoid system, we can modulate it through diet and lifestyle, but CBD is really, sort of the main driver for providing that balance. So I think that's why, people are reporting such benefits as well, because, the endocannabinoid system can take so many knocks. It's so important in our body's homeostasis. Taking a product that is then just going to give it that little boost, we're going to feel better. So I think, the boom really was, a lot of word of mouth. I think also the fact that, it's quite controversial, as you say, because of the link to marijuana or cannabis rather, and THC. So it automatically gets people's attention as well. And, it's one of those products. Everybody has jumped on the bandwagon. I think the market is worth over £300 million a year now, which is more than vitamin D and vitamin C combined, which is absolutely incredible. And so, that's why research and regulation is playing catch up now, because, as you say, there are a huge number of products on the market. And it's now sort of, again, I really take a role in this, in helping people understand how to choose a product and to get the best product for what you need, and how to use it as well, because it's not just a simple case of just whacking in a load of drops or, taking a vape. You need to balance the endocannabinoid system and not shock it into action. So.
Yeah, 100%. And we're definitely going to touch upon the right products in just a minute. But something I really wanted to cover with you, and it's kind of related to MS, is that there was a product called Sativex. I believe it's Sativex. And that was the THC CBD blend, which I thought was extremely interesting. And even though you can get some forms of medicinal cannabis in the UK, it's still very restricted now. And I wanted to know what your thoughts were on it and where the kind of roadblocks are to these products being more widely available.
So first of all, yes, you're right. Sativex, however you'd like to pronounce it, it contains a 1-to-1 ratio of THC and CBD. So THC is not the bad guy. I want to put it out there. It just, at the moment, makes a product illegal if you don't carry the right regulation and the right licenses. So THC at the right levels does play a part in supporting the endocannabinoid system and therefore pain and, other processes as well. So that's why medicinal cannabis is available. But as you say, it's available and is now Schedule 2 rather than a Schedule 1 as well. So they're sort of, trying to bring this more into the mainstream. But I think the roadblocks really is understanding, medical understanding. And again, this is where, I play a role, with a host of other practitioners and clinicians as well, is to really raise awareness of medicinal cannabis and, how it can be used and the importance. So, really within a clinical setting, medicinal cannabis has the roadblocks of misunderstanding and cost as well, will be one of those issues. But the very fact that Sativex has been passed by National Institute of Clinical Excellence, by NICE, shows that, products are safe, that CBD, THC is safe. And also there's Epidiolex as well, which is a CBD only product for very specific cases of or various forms of childhood epilepsy. So again, it's kind of proven that CBD, either on its own or in a mix with THC and medicinal cannabis, is a safe product as well to take.
Yeah, the Epidiolex, or how did you pronounce it?
Yeah, Epidiolex.
Okay,
yeah.
Epidiolex. One of the two. I was really interested in this product because it's only CBD by itself, and I was thinking it's for drug-resistant epilepsy. And then I was interested, and this is how my brain works, right? And I was interested, well, if that works, I wonder if it's through a similar mechanism to why a ketogenic diet might work in children with epilepsy, because I know certain dietary interventions can modulate the endocannabinoid system. I've not looked into this, Elisabeth, so maybe you can enlighten me on this, whether I'm putting points together or am I completely off base, because I'm quite happy to be schooled on either.
Yeah, no, I mean, I wouldn't put you sort of off base. I think, you're right in both senses that ketogenic diets in a clinical settings, I mean, a full ketogenic diet, especially in children, is something that needs full clinical supervision, but does have great results. And actually in my clinic, I've done what you could call maybe partial ketogenic diets, so not to the full extent in children, and seen a dramatic reduction in seizures, just through almost sort of partial ketogenesis. You're right that the diet can modulate the endocannabinoid system. In particular, though, it's fatty acids that are very important, because actually anandamide, 2-AG, the body's own endocannabinoids are formed from phospholipids found in cell membranes. So it's the sort of omega-3, omega-6 fatty acids and ratios there that are really going to influence the endocannabinoid system and its function. So, you could use both, sort of the CBD to modulate endocannabinoid system and ketogenic diet type approach. And, there I'm sure is crosstalk. I'm kind of pulling through my little sort of library Rolodex in my brain and can't sort of think of any particular papers that are cross-linking the two at the moment. But that's not to say that that's not, a potential that's there.
Okay, fantastic. Thank you for clearing that up. When you said omega-3 and the phospholipids, would it be more beneficial to consume them in the phospholipid form, so through like krill oil and things of that nature, or fish roe, although not many people are eating fish roe these days, or just the general through fatty fish and things of that nature, oily fish, I should say?
Yeah, absolutely. I mean, gosh, you've touched on another point that I'm passionate about, which is bioavailability of nutrients and how they actually get into the body, and what we're taking in terms of food and food supplements. So you're right that phospholipids are better absorbed actually through the gut. They're absorbed through into the lacteal system rather than requiring the sort of the bile and the lipase, which is the triglyceride form of fats, which is the EPA and DHA, the omega-3s that are found in oily fish. But the body, as long as sort of fat digestion is relatively good or excellent, if people aren't struggling through lack of bile and gallbladder, for example, then actually sort of intake through the diet of phospholipids and other forms of omega-3 essential fatty acids is going to be fine. But I do recommend a krill oil if people are struggling with fat digestion. I mean, a good quality fish oil, again, is well absorbed. If we want to get very technical, I would look for the triglyceride form rather than the esterified form, the EE form of fish oils. So if you want to get very technical in terms of supplements, the triglyceride form is better absorbed. But yeah, I think as long as we're sort of optimizing fat digestion, and it goes back to our clinical practice, doesn't it, as functional medicine practitioners, is that actually we're looking at the gut first and foremost, what's happening in the gut, digestion, absorption. So yeah, we need to address it from that side as well.
Okay, fantastic. That's hugely interesting. Maybe if we can touch upon, because I really want to touch upon the kind of dietary aspect of this as well, and other ways you can modulate the endocannabinoid system. But one of the things I was interested in also is kind of the efficacy of CBD on other conditions which it isn't currently prescribed for. So we've touched upon epilepsy, we've touched upon Sativex for MS. There is another drug out there, which I can't remember the name of, for another condition, Parkinson's, I think it is, but maybe I'm wrong.
Yes, that's being looked at the moment. Yeah.
Okay.
Yeah.
It's
in terms
in the
of seizure and sleep. Yeah.
Yeah. I was wondering, because a lot of people use it for things like anxiety and things of that nature, but it seems that the evidence, like you said before, you referenced before, is relatively lacking in this area. And I wondered what you thought of in terms of a dosage, because in the literature, from what I've read, it ranges from upwards of 100 milligrams, when quite often the doses in supplements are maybe 5 to 50.
Yeah, again, really good points. So as I say, I am a neuroscientist, clinical researcher. So, I do hold my hands up and say, we've got a lot more to come in the clinical research arena. There are, preclinical studies, are very solid in terms of how CBD and maybe we'll talk when we talk about products, other phytocannabinoids as well, because it's not just CBD and THC as we were talking about earlier. But CBD, does, reduce pro-inflammatory markers and works within the gut, works within the heart, the brain. So preclinical evidence is very solid. There are some good studies around that are beginning to come out, clinical studies now as well. There was an American group that brought out last year, 2019, one looking at CBD in anxiety and sleep, and showed that out of a group of 72 people that there was a almost 80% reduction in anxiety and an almost 68% improvement in sleep quality. So, that would, it is when you begin to compare to baseline for these types of studies. There's also studies looking at arthritis as well, in particular rheumatoid arthritis, and a reduction in inflammatory markers within the synovial capsule and the fluid there. Also interestingly within that study, which was done in 2017, there was a look at bone erosion, and there was a reduction of bone erosion basically within that study. So, again, the potential for using CBD as part of a program to, support bone health as well is really huge. And I mentioned the sports arena, but, working with people with early onset arthritis and, a lot of bone issues, this has real legs, quite literally. So in terms of the dosing, you're right. Some of the studies do use high doses. What I find clinically is that really most people are, sort of kind of 40, 50 milligrams tops a day. You're right in terms of dosing that, really, I would always recommend start low, go slow with CBD, because you're balancing the endocannabinoid system. So, really your first doses may well be equivalent to maybe 2 to 4 milligrams of CBD a day. So, that can equate to a couple of mouth sprays, for example, in a lower dose product. And then you're working your way up. And, obviously body mass size makes a difference. If I'm working with a, big rugby player versus myself versus, a teenager, for example, then, dosing is going to be adjustable. But, that's why you're starting low, because you're starting and then you're balancing the endocannabinoid system. CBD allows that balance, and then you can build up the dose if necessary. But clinically speaking, I'm finding most people are on between about anywhere 15, 20 milligrams up to 40, 50 milligrams. I personally take 15 milligrams a day, every evening before bed for sleep, and I haven't increased that dose for the last 10 months, 12 months. So you reach that ceiling benefit as well, therapeutic benefit.
And when you say there's the therapeutic benefit, is there an effect that you're looking for? Obviously it relates to a number of different conditions, but is it something which you can actually feel a sense of relaxation, maybe an hour after you take it, or is it something which you will feel benefits long term?
Yeah, everyone's different. And I know this sends shivers down clinicians' spine, and it used to with me as well, because we like hard facts, don't we? We like to be able to tick off. But, again, the reason being, I think, is because CBD is this elegant system of helping the body balance its own endocannabinoid system. Drugs are very blunt tools. The majority of pain relievers, block something, and they just blanket block so that there is an immediate switch off of the inflammatory response, but at the same time potentially blocking other areas as well, like various cyclooxygenase enzymes for aspirin and creation of side effects. So with CBD, because it's balancing the endocannabinoid system, some people experience, if I assume, and again, maybe not such a clinical word, but again, I have a lot of clinical experience with this, is that their endocannabinoid system is really needing a good balance. So people are seeing effects, really quite quickly, within the first few doses, and even the first dose for some people. And yeah, that's, quite often a relaxation, and, that's quite often a sense of calm. Maybe if it's helping to improve sleep, then you're going to feel better the next day as well. Mm-hmm. So I always say, as a practitioner, as a clinician, expect the unexpected. We might suggest that you include CBD as for part of your program to manage pain, say, maybe an injury, back pain, joint pain. And, people might say, oh, well, actually, I didn't feel joint pain relief straight away, but I slept so much better. So if they're sleeping better, their body's going to balance, their inflammatory response is going to balance out. They're not going to perceive pain as much. So, again, it's kind of that sort of knock-on effect. So for some people, there might be a direct, straight away, I feel less anxious. I slept so much better last night. I've had a lot of people reporting to me about sleeping straight away after first dose. I've had the best night's sleep I've ever had. If we've got a bit of placebo effect in there as well, do you know what? That's fine by me if people are getting better sleep, but at the same time, that carries on, so it's not just a placebo effect, that I'm very sure. So yeah, it's a way of, people will sort of see, and perceive those benefits as well, that where their endocannabinoid system is balancing.
That's really good to know. I guess it's making me think, I probably need to check my own dosing, because I've only been playing around, been using CBD.
We research on ourselves, don't we? I'm the first one to admit
that. With different doses of CBD. And something which I've found also is sometimes I find it, and maybe it's something which I've not experienced enough to tell, that if I push the dose a little bit too high, I find it quite energizing. Is this something which you could probably help explain, or is it just something that you've heard anecdotally?
So, for some people, as I say, so CBD is not a sedative for a start. Even if you're using it for sleep, you can still use it during the day to help feel relaxed. It's not, causing a sedative action. But as you said, for some people, they might get this almost, for some people, slightly hyper feeling as well. As you say, that sort of real energized feeling. I would always go back to the brand that you're taking, first of all, just to check. Any brand will be able to provide their certificate of analysis to show the lack of THC and the levels of CBD, because there are still brands on the market that, maybe have slightly higher THC levels than is legal, certainly in food supplements, but that, have the potential to provide a bit of a buzz. Obviously, if it's a sort of, clean brand, for want of a better phrase, then, I would sort of say that, you're at a dose where the endocannabinoid system is, triggering, or motivating, sort of parts in the brain and energy wise. So, it's about finding that dose that's right for you as well. And as you say, tinkering with those doses as well. But that's why it's better to work up rather than just to take a whacking great big dose at the beginning and either not feel anything because the endocannabinoid system doesn't know what to do with it, or feel anxious or a bit hyper. So.
Okay, that's really interesting to know. Yeah, back to the drawing board, I think, for me.
Yeah, well, as I say, it's good to experiment and, good to try these out. But, by starting low, a couple of drops, a couple of mouth sprays, and then sort of, every couple of days, every 3 days, building up that, dose by a 1 or 2 drops or mouth sprays, then, that, will give a sort of quite a good indication of what your body's needing. And I say mouth sprays because it is best absorbed under the tongue. I know you can get capsules, but, sort of, again, absorption, first pass, metabolism of CBD from that route does kind of knock down the levels quite a bit. People still report benefits, but I would always say a sublingual application is the most profound, though you can get rubs, muscle rubs, joint gels, and they act at the surface and can also provide sort of additional benefit as well.
Okay, they just act at the surface, or do they have systemic benefits? Because I've seen patches as well for transdermal.
Yeah, I mean there is a certain amount of absorption, but it's a very low, to get into the circulation systemically. So they're more acting locally. These types of products.
Okay. Very interesting. And in terms of, I guess this might be a question for a lot of people, like vape pens and things like that. I think there's a lot of issues with vape pens with the chemicals involved in them, but the CBD, let's touch upon that primarily. What's the benefit, or is there a benefit of having it in a vaporized form? And is there any negative side effects?
Well, yeah, I mean, so yes, I must say that that's also a very good route to get CBD into the body. It is through vaping. We've got actually a whole host of endocannabinoid CB2 receptors around the respiratory system as well. But you did touch upon the problems, if you like, around vaping. And, I'm not really a fan of vaping. Obviously, it's, provides health or not benefits, but is sort of better than the other alternative. But things like polyethylene glycol, PEG, they call it popcorn lung, don't they? Where there's sort of a respiratory disease seen in popcorn workers that use these chemicals that get into the air, and it's very similar with vaping. And so really, as a route of getting CBD into the body, then a mouth spray, which is CBD in a medium chain triglyceride or coconut oil base, or maybe a hemp oil base, is going to be sort of kind of the safest option, really. So yeah, vaping is an alternative, but I would always stick with the oral route.
Fantastic. You mentioned athletes before. How are they using this? Basically, how are they using this? Is it more of a recovery element, using it topically? Because I've seen joint and muscular creams, which I've played around with as well. I did a marathon recently, and I used that on my calves, and it helped a lot in terms of like tightness, or certainly my perceived level of tightness and soreness. But I don't know whether that was placebo or not.
Well, first of all, congratulations on the marathon. Very impressed.
You.
And yeah, absolutely. I mean, you can say that if you're using, a CBD rub, then obviously you are, massaging that area as well. So that's going to have, positive, muscle benefits in terms of tightness. So again, there's probably a whole host of reasons why a CBD cream is going to be working or rub. But also, say there are CBD receptors at the skin and at the skin surface, and there's going to be a little bit of absorption across the dermal layers. So there are reported benefits. There is a sort of science stacking up behind that. I've forgotten the first part of your question.
So it was just basically how
Athletes, how do
use
athletes
it.
use
Yeah.
it? That's right. Okay.
I should stop asking multiple questions in one go.
No,
It's my
that's
fault.
fine. I'm normally quite good at holding everything, but that just went off. So okay. So in terms of sport as well, how athletes are using CBD, as I say, it's legal. So that's a really positive side. But again, taking products, need to, show that there is 0% THC. So it's very important, again, that athletes, especially tested athletes or professionals that are tested as well, are getting products that show 0% THC in there, because even the 0.2% has the potential to trigger a drugs test. So there are products on the market that can show that. And then, I find the athletes that I work with are using CBD, certainly in recovery. Sleep is a very good one. People are very hyper after a match, after their performance, switching off. So CBD is a very good way of just sort of calming things down. It stops the reliance on alcohol and that side. And then also in performance, in terms of performance anxiety, there's a big issue around performance anxiety for a lot of athletes that I've worked with. And, the pressures are huge when you're on those, sort of national and international stages. So again, CBD can be used just to help, have that calm feeling and regain that focus and clarity. And then, of course, actually just going back to the recovery side is that pain reduction and reduction of inflammation. So, I know of athletes that have totally come off pain relievers and very strong pain relievers as well, and are now solely using CBD and their sort of lifestyle approaches to manage, injury and longer term injury associated pain. But I think also what's interesting, for everybody, but in the sports arena as well, is that there's a lot of research now coming into how CBD can help tissue repair. So again, in the performance side, there's a reduction of oxidative stress. So this is very important in a peripheral level, at a tissue level. But when we're talking head injuries, things like, sort of the acute concussion, head injuries, but also the CTEs as well, the chronic traumatic encephalopathies that we're seeing in a lot of contact sports. So again, in the States, there's been a lot of work now, certainly in CBD, but actually bringing medicinal cannabis into the baseball league, into the NFL, the National Football League as well. So hopefully we will see a sort of translation of that across into the UK as well, because there's no doubt that head injuries, we're seeing some of the older generation of footballers now dying from dementias. Obviously, the rugby world that I work in is sort of rife with concussion and head injuries. So if we've got something again that can work at a tissue level, reducing inflammation, the oxidative stress, then it could be a very powerful tool.
That's incredibly interesting to know. I was reading a lot recently about the TBIs in American football and how they're having long-term effects in terms of their mental health to do with these kind of post the event years afterwards. So it'd be interesting to see if CBD would have some form of benefit there. Absolutely.
Yeah, it's a huge problem, and certainly in the States, we'll talk about the research that's done there, the reliance then of really strong opioid based painkillers, and as you say, we get the mood changes, we get addiction into these highly addictive painkillers, the opioid based ones, and all of the problems that ensue there. So yeah, they're doing a lot of work in the States now around CBD and medicinal cannabis to help in that area. So as I say, I would like to think that we could translate and move that research across into the UK sooner rather than later, and I'm certainly on the case.
Brilliant. This is great. Okay, in terms of the endocannabinoid system, is there other ways to modulate it? So we kind of touched upon diet, which I want to revert back to, but whilst we're on the exercise, does that modulate it in one way or another? Because that obviously has a huge hormonal effect.
Yeah, absolutely. I mean, again, there's no sort of hard and fast evidence at the moment to taking measurements in this area. But I would say, if you're getting the right amount and right level and right type of exercise for you, so you're pushing yourself enough, but you're not tipping yourself over into chronic stress, then yes, you're going to be balancing your endocannabinoid system, because you're going to be, it will have to be working to provide that homeostasis, but at the same time, you're going to be strengthening, your body's resistance. So yes, it's going to have an impact.
And then maybe we can revert straight back to diet, because I know there's certain things which actually contain these endocannabinoids, like chocolate with...
Yes, my favourite.
Was it andamide? Am I saying that right?
Anandamide.
Anandamide, okay, which is that bliss molecule. Is there anything else within chocolate, or what are the benefits of that molecule itself? And is there any other chemicals which are beneficial?
Yeah, so this, I promise, isn't the reason why I got into the endocannabinoid system, because I'm an absolute chocolate fiend, dark chocolate, raw chocolate fiend. But I was really, sort of pleased to find out that dark chocolate contained anandamide, which is one of the endocannabinoids in the body. So, we can directly eat these endocannabinoids. And, I don't drink caffeine, I don't have other stimulants in my diet. So I find actually that raw chocolate and dark chocolate does provide me with quite a boost. And I do feel good after eating it. And, it's not the sugar, because I have the super low sugar or no sugar ones. So I do think that there is that sort of boost around that as well. So certainly raw chocolate or raw cacao contains anandamide. Another very good one. And again, what we're probably, already recommending this as a practitioner as well, because there are various herbal remedies that contain anandamide in particular, and echinacea is one of those. So again, at this time of year, maybe we're looking for extra immune support, but echinacea is also containing anandamide. So there are certainly things that we can use within the diet, maybe within some of our sort of food supplement areas, to be supporting the endocannabinoid system as well.
So we touched upon omega-3, chocolate, echinacea. Is there other dietary things that people might be having on a daily basis which may be beneficial as well?
Well, I think, on an indirect basis as well, people are going to be supporting the endocannabinoid system. So rather than sort of directly taking on board endocannabinoids, then, the types of whole food diets, the approach that we take within our sort of lifestyle practice is going to be supporting the endocannabinoid system. So yes, I think really, the more that we can do with our diet, the more we're going to provide balance in that area.
I had a question, which is, are all CBD products created equal? And you mentioned they're not. Maybe you can dive into a little bit more why that's the case, and maybe what brands you recommend also.
Yeah, of course. The CBD is so we've said, a really booming market. And so there's all sorts of products and imitation products out there. So first and foremost, I would say you want to choose a brand that has the certificate of analysis that shows each and every batch exactly what's in the CBD side. So we mentioned that it's not just CBD. There are other phytocannabinoids as well. Obviously, we want to avoid the THC in a food supplement product, and especially if you're a tested professional or athlete, then 0% THC. But you can get different types of products. So there are what we call full spectrum products. So they contain CBD as well as other extracts from the hemp plants, other phytocannabinoids, terpenes, flavonoids, which all have the potential to work together and to provide the effect. So CBD is one of the sort of the main active components in there. And the full spectrum will contain less than 0.2% THC. So there will be that sort of trace THC present. But you can also get CBD isolate products that are coming on the market now as well. So they contain just the CBD extract from the hemp plants. And, really the reason being is that they are obviously going to be totally clean, if you like, for tested professionals and athletes. Mm-hmm. And, so just containing CBD, because actually WADA, the World Anti-Doping Authority, they're a little bit, it's a bit of a grey area as to how they feel or how they perceive other phytocannabinoids other than CBD. So, for tested professionals, they might actually want to avoid all the other phytocannabinoids, so CBN, CBG, CBDA, there's a whole host of them, and just take CBD. So the CBD isolate products can be quite useful from that point of view. So in terms of, choosing your product, you want to go to a trusted brand, one that can provide that testing knowledge, maybe that they've also, not even maybe, that they have got their products third-party tested as well, which is very important, so that, they're not just doing in-house testing and wanting to find what they want to find. The brands that I do recommend is 45 CBD. So those are the words 45cbd.co.uk. The reason being is the brand is owned by England rugby players, England and Welsh rugby players, and therefore they want the cleanest product and the product that is going to work So they provide all of the certification. They have a great range of products that have, I've seen clinically in action, both in professional athletes through to within my clinic, other clinic areas as well. So, again, it's about, understanding, the product types. And I would always say, start with the mouth spray or drops. You can get the product in and start low. So start with the sort of 500 milligram or 1000 milligram product, and then you can work your way up once you've got the dose you want. And of course, you can then, sort of halve the dose if you're taking double the amount, so that you can save money. So, you can kind of work your way up as well. But check out the 4-5 range, 4-5 CBD. They've got a host of sort of muscle rubs and what they call their pro range, which is 0% THC. And third-party tested by BSCG, which is the Banned Substance Control Group. So they test for over 400 products, including THC. So these are super clean products.
I was just thinking about this, and it was to do with the, what was it? When you said you have a question that floats away? That's exactly what's happened. No, it's back. It's back.
Good. Netted it.
So it was about drug nutrient interactions, or is there any drug interactions with CBD that people need to be aware of?
Yeah, that's a great question, Ben. And yes, there is. But first of all, I would like to put it out there that while CBD does interact with the liver enzymes, which are responsible for groups of drug metabolism, and I'll come back to which drug groups those are. So I'm talking about the liver CYP P450 enzyme groups. Mm-hmm. But what I would say is that this is not unusual. I sometimes this is used to kind of sort of show that CBD isn't safe, or that a lot of people shouldn't be taking it. But actually, CBD is a natural plant nutrient, and a lot of plant nutrients in the foods that we eat, maybe in herbal remedies that we're taking as well, do interact with these liver enzyme groups as well. So it's not just CBD. This shouldn't be used as a reason to, sort of not take CBD or say it's dangerous. It's a natural plant nutrient interaction. That said, yes, CBD does interact with certain of these groups, and the sort of major groups of drugs that are metabolized by the P450 enzymes that CBD interacts with are groups of sort of antihypertensives, warfarin, certainly some of the blood thinners, the anticoagulants, certain antidepressants as well. So, we do need to be aware of this as clinicians. There is one particular safety study, though, which is a very useful one, which has shown, though, that this was actually done back in 2013 by Stott Group. And that showed that it was more than 50 milligrams of CBD daily that has the potential to interact with these enzyme groups. So really what I find, as I say, is the majority of people that I work with are taking less, and quite considerably less, than 50 milligrams daily. And in fact, there are current guidelines which recommend no more than 70 milligrams of CBD daily. This isn't wholly rooted in science, but, I kind of get that, they want to be putting on, sort of levels of sort of safety onto food supplement labels. But, so what I would say as a clinician or somebody that is already on maybe a drug is to, sort of investigate it, say you feel free to contact myself, look into, the information that's available, but that you can take CBD, at lower levels with certain drugs that are there. I mean, it's not my remit. I don't hold, sort of GMC, level sort of certification qualifications. So, it's not within my functional medicine practitioner remit to suggest people ever remove the drugs from their regimes. But, I do know of people that have worked with their medical clinicians to, sort of dovetail and reduce down off medications, pain medications, for example, anti-anxiety, anxiolytic medications, to sort of use CBD as a natural alternative. And I've worked with a lot of athletes, professional athletes that now solely use CBD and lifestyle to manage their, sort of inflammatory pain that they've experienced.
Is there potential for people to take CBD and have an adverse reaction?
No, I mean, the safety profile is excellent. So it wouldn't be passed by NICE if it wasn't. It's not recommended in pregnancy or breastfeeding because there's just simply not the understanding or the data that's there. Again, sort of anecdotally, people have reported quite vivid dreams. Maybe I must say, there was one night when I double dosed because I forgot I took a dose, and there were some really strong dreams. It wasn't a problem, but it was just like, woof, when I woke up in the morning, that was quite full on. Much higher doses, in some of the studies. So the sleep and anxiety study, there were 3 people that reported mild diarrhea, but again, they were on like 150 milligrams.
Right, yeah, so that's much higher than you would ever recommend then.
Well, it is, but then they take capsule form. So, that study was using capsules rather than oral dosing. So, the absorption would have an issue. Some of the studies are saying it's as little as sort of 10-15% you absorb through the gut. So, if that's the case, that's why some of the higher doses are used in the studies if they're using capsules. But no, generally speaking, it's very safe. The toxicity studies, all of that show good safety profile.
Fantastic. And that's really interesting that you say that, because I've been taking 25 milligram capsules now for, I think, 2-3 weeks. And I think that's a pretty good dose for me, because I feel like I'm having a good benefit from that. But before that, when I was talking about being energized, I was taking the drops underneath the tongue, and because you've explained why it's more bioavailable, I'm thinking maybe I took too many of those, and that's the reason why I was feeling a little bit more energized, almost hyper, like you suggested, and it was quite hard to get sleep. It's just interesting that you made that connection. Just moving on to the last 3 questions that I ask every single person that comes on the show, with the first one being, how do you think healthcare can become more integrated with the kind of modalities that we've discussed today?
Well, I think, firstly, we need to consider the endocannabinoid system more. I think that as practitioners, we are taught, especially, in lifestyle or functional medicine approach, we're certainly taught about, cardiovascular system, the central nervous system, the immune system, and, we put all of that together. But what we don't do is consider the endocannabinoid system. And hopefully what I've done today is really illustrate, quite how important it is and quite how we can go about effectively modulating and regulating it. So I think in terms of enhancing our practice and our clinical practice, then incorporating the endocannabinoid system into our practice is only going to make it better.
Fantastic. And hopefully everyone can hear the slight hum of someone chopping a tree down outside. So we'll continue though.
Okay, yeah. No.
The second question is, what is the most impactful health change that you have made in your life and why?
Well, it's an interesting one, and I was thinking about this, and I think probably the biggest change was when I discovered the benefits of nutritional medicine. So that's not to say that I did one thing and then stuck with it, because of course with the studying that I've done now, my nutritional medicine degree, and going on and with my functional medicine clinic, I do many different things with my diet now and tinker. But I would say actually really beginning to understand the power of food and the power of what I was eating and when I was eating it as well, has made the biggest difference to my health overall. So I would always urge people to just keep on learning about themselves and about what foods work and what don't work, and the timing of eating. And that's really going to have benefits as you move through.
And just to add to that, I've actually done an elimination diet whilst we've been in lockdown. And discovered some foods which I didn't realise I had a little bit of a problem with. The third question, can you please provide the listeners with 3 tips to help improve your health and well-being from today?
Of course. Well, first of all, I would say have a think about your endocannabinoid system. And, it might be that CBD is something that you want to add in. Again, I'm not saying that it's something for everybody necessarily, but, certainly what I've talked about today has kind of illustrated the many areas that CBD and all the endocannabinoid system is involved in. So I would really say, have a think around that area. In terms of, using CBD, but also sleep is absolutely key. I always say it's the quality of sleep that you're getting is really important. So I would always say to people, have a think about, what you're doing to get better quality sleep. So, if that's switching off your phones, an hour before bed so you're not mentally exerting yourself, if that's getting a better bedtime routine, if that's adding CBD into the mix to help, to get a better quality of sleep. Because if we can sleep better, and I'm not necessarily saying sleeping for longer, it's the quality of sleep that's important, so how we feel when we wake up, then that's going to have a positive knock-on effect to all other areas of our health as well. And kind of along those lines is, really think about ways of, sort of managing stress. So, my sort of third tip is to look, either at meditation, and I sometimes call that the M word because people are a little bit unsure if it's for them, but certainly incorporating maybe a breathing exercise into your sort of daily routine, because, there's a lot of evidence to show that if we regulate our in and out breath, we slow our breathing down, then actually we're providing such an important balance and stress reduction to ourselves. So I would, really say investigate what works for you, whether it's simple breathing exercises, something like the Calm app, for example, or whether you want to sort of try full-blown meditation and, try that side where you're spending a few minutes of a day just being quiet. But I think combining those things together, better quality sleep, calming our nervous system, balancing our endocannabinoid system, is really going to set you up.
Well, Elisabeth, it's been an absolute pleasure to speak to you today. Thank you so much for taking the time to come and speak to me. But before you go, can you please tell the listeners where they can find you and what exciting projects you have coming up?
Of course. Well, it would be lovely if you wanted to join me via social media. My Instagram is at Dr. Elisabeth Philipps. It's Elisabeth with an S, but I'm sure you'll find me coming up. And you can join me on my CBD adventures because I like to post a lot around CBD and neuroscience and gut-brain axis. So, hopefully you can join me there. You can also find me on LinkedIn and on Twitter at Dr. Philipps. So feel free to direct message me, contact me through those channels, and I will get back to you, and we will be able to sort of find out more about CBD and the endocannabinoid system. And in terms of exciting projects, I'm always doing a lot of research around the endocannabinoid system and CBD. So I've got a couple under wraps at the moment, but all will be revealed next year. So I would just say, watch this space, join me via social media, and I look forward to being able to share even more about the endocannabinoid system with you coming up.
It's been an absolute pleasure to speak to you again, and I do hope that we can do this again soon.
You too, Ben. Thanks very much for having me on. Thanks for listening, everyone.
Thank you for listening to the Functional Health Podcast. You can find links to everything that we talked about today in the show notes. If you have a second, please consider leaving a 5-star rating on iTunes. It really does make a huge difference and helps get this valuable information out and reach more people. Don't forget to subscribe so you can stay up to date and know whenever I release a new episode. You can connect with us on Instagram, Facebook, or our website, and all questions are welcome. As always, thanks to Joss Aurelia for the editing and Alan Harper for his support.